I am so elated to meet you in the program of 1 minute please. So what are the drugs that are available belonging to carbapenems? We have imipenem and meropenem and ertapenem and doripenem. So what are the key difference between these carbapenems? First, imipenem. So imipenem, the dose frequency is more. I mean it should be given 6th hourly. And the most important one, the imipenem is simply degraded by our renal dehydropeptidase. So to inhibit dehydropeptidase, you need to add celastine. So if you give imipenem alone, it will be easily degraded by our kidneys. To prevent the degradation, we need to add celastine along with imipenem. So imipenem requires celastine. It should be given 6th hourly, and moreover, as compared to other drugs in the class of carbapenem, the potency of inducing seizure is more with imipenem. Then what about meropenem? Yes, it should be given 8th hourly. The key difference between the imipenem and meropenem, as compared to imipenem, meropenem can act against gram-negative bacteria more vigorously. On the other hand, imipenem is very much active against gram-positive bacteria. But what you have to remember that all the class of carbapenems can act against gram-positive, gram-negative and anaerobes. But the key difference is the meropenem can act against gram-negative bacteria aggressively as compared to imipenem. As compared to imipenem, meropenem has less potency in inducing seizure activity. Then what about ertapenem? Yes, ertapenem, the biggest advantage of ertapenem is OD dose. But the problem is it is less potent as compared to meropenem, where it plays a major role. If somebody is on meropenem and they are getting treated with meropenem, and when they are recovering during de-escalation, then probably meropenem can be switched over to ertapenem. Otherwise, what you have to remember that ertapenem is not active against Pseudomonas. So if you have culture proven Pseudomonas, then ertapenem should not be given. And second one, if you suspect Pseudomonas bacteria, then you have to avoid ertapenem. Then what about doripenem? So doripenem, it is not FDA approved, but still it is available in many countries. But there are some controversial report about high mortality among doripenem treated ventilator associated pneumonia. So there is a main concern. Otherwise, doripenem is not widely used by us even in India also. So these are the key difference between the carbapenem. So take home message, as compared to other drugs in the class of carbapenem, meropenem has gained huge popularity among the practitioner because it is less potent in inducing seizures. It has very good active against gram-negative bacteria. But what you have to remember that meropenem cannot act in few conditions, namely MRSA infections, and when you suspect enterococcus infection, then you have to avoid meropenem. Then so-called carbapenem resistant enterobacteriaceae, that is CRE. So these are the organisms can resist against the antibacterial action of meropenem. Thank you.